Hi guys, welcome back to my channel after a long weekend. Hope you have enjoyed your weekend. So let's start today's class. So we were on vasoconstrictor. We were about to start vasoconstrictors. In 1897, Abel discovered adrenaline, the most commonly used vasoconstrictor along LA. In 1903, Braun suggested using adrenaline as a chemical tourniquet to prolong the duration of LA. Okay, it is termed as chemical tourniquet. Some of the classification of LA, there can be catecholamines or non-catecholamines. Under catecholamines, there is epinephrine, norepinephrine, levonorepinephrine, isoproterenol, and dopamine. In non-catecholamines, there is amphetamine, ephedrine, phenylephrine, methoxamine, and metamenol. So the most commonly used is epinephrine or norepinephrine sometimes, and in catecholamines, the most commonly used is phenylephrine. Okay. Now some of the concentration of vasoconstrictors. 1 is to 1000. It is most commonly used in anaphylaxis. Okay, this is the life-saving drug in anaphylaxis. 1 is to 1000 concentration means 1 mg per ml. Okay, then 1 is to 10,000, 1 is to 50,000, 1 is to 10,000 is 0.1 mg per ml, and 1 is to 50,000 is 0.20 mg per ml. These concentration of LA is mostly used, vasoconstrictor is mostly used in cardiac arrest and other medical branches. And from 1 is to 1 lakh to 1 is to 2 lakh, that 1 is to 1 lakh is 0.10 mg per ml, and 1 is to 2 lakh is 0.005 mg per ml. Or we can say from 80,000 to 2 lakh, we mostly use this concentration of adrenaline in LA in our procedures, in dental procedures. Okay. Now, how to calculate? I'll give you a short example on calculation of dilation of vasoconstrictor. Okay, 1 is to 50,000 means 1 gram per 50,000 ml. This is gram, this is ml. Okay, converting into the same unit, that is 1000 mg per 50,000 ml, which means 1 mg per 50 ml, which means 0.02 mg per ml. Okay, and same as this 2% lignocaine is 2 gram per 100 ml. Okay, this is 1 gram per 50,000 ml. This is 2 gram per 100 ml. Percentage is 100. Okay, this is gram, this is ml, this is gram, this is ml. Okay, in short, I can tell you this, कि with vasoconstrictor we can give 12 to 13 syringes, and without vasoconstrictor we can give 7 syringes, and it depends. It's not the universal thing, it depends on various factors, the side effect, the patient, everything, but in general we can. Okay, studying about some of the vasoconstrictor, the most potent is epinephrine, which is also known as adrenaline. It acts both on alpha and beta adrenergic receptor. Okay, now norepinephrine, it is 1/4 as potent as epinephrine, and it acts on only alpha sites. Same levodopa, it is 1/5 as potent as epinephrine, and it also acts on alpha site. Okay, this is the most common question asked in MCQ, the future, or in your viva, the future trend in pain control. Okay, so first drug is centbutridine. What is this? Centbutridine. It is quinolone type, quinolone derivative. Next upcoming thing is ropivacaine. Okay, next thing is eutectic mixture of LA, which is also called EMLA. And then there is ultra long acting LA and electronic dental anesthesia, that is EDA. Okay, coming to complication, we have done with definition of LA, classification of LA, components of LA, mechanism of action of LA, and we have done with vasoconstrictor. Now we are coming to the last or main part is complication of LA. Then what is complication? An anesthetic complication is defined as any deviation from the normally expected pattern during or after the securing of regional analgesic. Once again, an anesthetic complication is defined as any deviation from the normally expected pattern during or after the securing of regional analgesic. Or they are broadly classified as primary or secondary complication, mild or severe, transient or permanent. Now, these three are again divided into attributed to solution, attributed to insertion of needle. Firstly, they are divided into primary, secondary, mild, severe, transient and permanent. And these three are divided into attributed to solution and attributed to insertion of needle. They are further divided into local and systemic and local. Means if it is attributed to solution, it can cause both local and systemic side effects. And if it is attributed to insertion of needle, it can only cause local. Okay. We will be discussing each of these in detail in next class. Till then, bye, take care, like and subscribe.